Hello, good afternoon. As we all know, the month of October has been set aside for us to sensitize on the need for everyone to be screened to rule out breast cancer. It is so because breast cancer is one of the leading cause of deaths in women, especially though one out of 100 men when selected, we will only find one out of them who will be having or who will be exhibiting symptoms or signs of cancer. But most of the times it is common in women. So I've taken this upon myself to use this media or this channel to sensitize those who do not know much about breast cancer. You might have heard about breast cancer, but you may not know much about it, especially when it comes to the preventive aspects. So due to that, as your midwife has taken it upon ourselves to sensitize our clients, because we love our clients and our major objective is what? Prevention and not to cure. Alright, so when we say cancer, what is cancer? Cancer in itself is just abnormal growth of cells within the body, and has the potential of what? Invading other nearby organs and also spreading to other parts of the body, which we call the metastasis. Alright, so right now, when we say breast cancer, it is a disease in which cells in the breast grow out of control. They grow out, meaning that they spread to even to the extent of other or nearby organs to affect them. And it can begin in different parts of the breast. With the breast, it's made up of three parts. Let's say three parts. The three parts we're talking about: the lobules. The lobules are in charge of making of breast milk. Then the ducts. The ducts are the channels in which breast milk flows to the ampulla, which is a large part for the baby to get the breast milk at the nipple. And then we also talk about the connective tissues. The connective tissues are made up of the fibrous and the fatty tissues. That's things that connects the whole thing, everything in the breast together. That is in simple words. So most of the times the breast cancers begin in the lobules. That is where the breast milk is produced. Then when depending on where the breast cancer begins, that's where you get the name. So those that begin in the lobules are called invasive lobular carcinoma, and we have those that also begin in the ducts. That is also called the invasive ductal carcinoma. These cancers, when they begin in these parts of the breast or these areas in the breast, they do not stay there, but they rather invade outside where they are, and then affects other nearby organs. All right, now what are some of the symptoms if one is having breast cancer? What are some of the symptoms that you know that, or as a woman or as a man, what do you see in your body that you will be able to say that no, I'm suspecting breast cancer? All right, first, you realize that there will be a new lump in the breast. Ideally, every woman after your menstrual cycle, you need to palpate your breast to do a breast examination to rule out any lump. Now, what I would like us to bring our attention on is that every woman's breast is made up of lobules. Let's say when you take an orange and you divide an orange into two, you see some things in it, round. It's the same thing when you take a breast and you divide a breast into half. They are the same things you see, and those things, scientifically or medically, we call it lobules. Now, these breasts, when you palpate them, you wouldn't feel it to be extremely empty, but you will feel something within that. There are some things in the breast. But how are you going to identify that this is a normal lobule and not cancer? One, with the normal lobules, when you do breast or self-breast examination, you realize that they are uniform. Like, they are easily pressable. There's no pain when you are pressing, and then it is though you may feel some lumps, but they are static, they don't move. But the carcinoma, the one that causes cancer, when you are doing the breast examination, it shifts away or it moves away from the hand or your palm, you realize that it will be dodging you as you examine the breast. It will be moving. When you sense something or when you feel something like that, then you should query cancer. Then you have to see your healthcare provider for what further investigations to be carried out. Do not stay at home. One thing too that I would like you to also notice is that during the breast examination, when you get to the nipple area, you need to squeeze the nipple. Ideally, when you are not pregnant, you're not supposed to see any breast milk, because pregnant women, when they come for antenatal, especially with the first time registrants, when we do physical examination for them, breast examination is part of it. It is also a way of helping us to identify these carcinomas early and then we're treating them on time. Now, if you are a non-pregnant woman and you press the nipple and you see any discharge, please take note of the discharge. When the discharge is pinkish or reddish, it is an indication that there is what? Cancer in the breast. That shows that there is a tint of blood. So that means the cancer has started eating up the cells in the breast. So that is what you are seeing. It is a mixture of blood and other things that you see. And so it is either pink or reddish. Then when you see something like that, it is not a good thing. Quickly visit your healthcare provider for assistance. Alright. Also, with a lump, when you take a woman's breast, let's say for instance, my breast, you realize that the breast extends to the axilla. So it is called the axillary tail of Spence. So it is also part of the extension of the breast tissue. So when you are palpating, please, especially those with heavy breast or big breasts, do not forget to palpate from what? Also palpate the armpit area or the axillary region, because there could be that there may be a lump under the armpit or around that area, which you may forget to do so. Alright. Then when you see any redness around the breast, it is not a good thing. You have to report. Then the nipple area. Ideally, the nipple area, we have something we call the Montgomery's tubercles. That's when you take the breast, the nipple, that darkened side. For those of us who are dark, it looks brownish, dark brown, and those who are fair, it looks pinkish. That side, there are some small dots there. That dot, its work is to what? Secrete sebum or oil to what? To lubricate the nipple. Ideally, the nipple is not supposed to be dry and flaky. It's supposed to be well lubricated by these sebum, which are being secreted through these Montgomery's tubercles or through these tiny holes around the nipple. So if it becomes flaky and dry, please do not take it as anything and then ignore it. Quickly visit your healthcare provider for assistance. Alright. Also, when you feel pain in your breast, ideally, you're not supposed to feel pain in the breast. The moment you start feeling pain in your breast, please visit any nearby facility or visit your healthcare provider for assistance. One thing that I would like you to know, that these signs and symptoms that I'm talking about does not really mean that you are having breast cancer until you are being diagnosed. So as healthcare providers, we also know that we have something called differential diagnosis. It's possible that it could be some other condition that may be setting in, but not necessarily breast cancer. But in order for you to be sure, please visit any nearby health facility for further investigations to be carried out, if possible, to rule out breast cancer. Alright, so what are some of the risk factors, or what will put one at risk of having breast cancer? We are saying that advanced maternal age, that is 50 years or more, those people are at a higher chance of getting breast cancer. And then we have the genetic mutation. You can get it through your genes. If it's through your lineage, you can get it. That is, if there is a previous history in the family too, that maybe your mother had it, your grandmother had it, your great-grandmom had it, your sister ever had it, then that means that you are also at a higher risk of getting breast cancer. We are also talking about reproductive history. Early menstrual periods before age 12 and starting menopause after age 55 expose women to what? Hormonal, like longer hormones. So the more women are exposed to hormones, the higher the risk of getting breast cancer. And also, breast cancer is also higher in women with very dense or very heavy breasts. Why am I saying so? Because very heavy breast or very dense breast has more fibrous and lesser fatty tissues. Therefore, it is very difficult to identify a lump even under mammogram. So by the time you realize, they are already in the other stages of the cancer state. Then, if you've ever had breast cancer before and you've been treated, there's a possibility or there's a higher chance that you may get it again. Then, if you also ever had breast cancer and you went through radiation therapy, that means you are having a higher chance to the breast cancer, because the radiation therapy, though you used it for treatment, can also expose you to a risk of getting breast cancer. And then women who take in too much alcohol, excessive alcohol, can also put you at risk. Excessive smoking too can put you at risk. And then hormonal changes due to night shifts, especially those of us who do night shifts a lot. Bear in mind that the night shift in itself will alter your hormones and also change your sleep pattern. It will alter so many things in you, cause a lot of stress on you, and this also leads to growth of abnormal cells. So you are at a higher risk of getting breast cancer. Now, how do we prevent breast cancer? Now, we can do it so by keeping a healthy weight. Keeping a healthy weight means that you have to check your calorie intake. You have to take in more fiber diets. You exercise well, and then you also take well-nourished diets as well. And you have to avoid alcohol intake as much as you can as a woman, including smoking as well. Then, if you have a family history of breast cancer, what you need to do is visit your healthcare provider, who will guide you on what to do to reduce your risk of being exposed or getting it too. All right. The last thing I also like to talk about is that breast cancer, though it is common with women, but men too can also have breast cancer. Just that with the men, when you take 1 out of 100 people, when you take 100 people, it's only 1 person that you can get having the breast cancer. And the signs and symptoms are the same as I have mentioned. All right. Thank you very much for your attention. Please, if there is anything that you didn't get or anything you didn't understand, kindly hit me up and I'll gladly explain to you. Visit any nearer or any health facility that provides screening, and then go and screen to rule out carcinoma or to rule out breast cancer. As the saying goes, prevention is always better than cure. The cure will waste your time, it will waste your money, and then it can also lead to a defect, because depending on the stage of the cancer, if it is a situation whereby nothing can be done about it, you should know that you may lose your breast, either one or both. Thank you very much. Once more, my name is Patience Efrifa, and as I already said, if there is anything you didn't understand, kindly type the question and I'll gladly attend to you. Bye.